Good evening, doctor.
Good evening. Hi,
Happy
everyone.
to hear your voice. Now let's see
Happy to
where's.
hear you all as usual, and happy to see so many of you
Oh, wow.
in the group.
Good
Yes.
evening,
So as you
doctor.
rightly said, Bali, every day is a blessing, and we need to always be happy and take one day at a time, and always try to stay in the pink of health. That's what we always
True.
use that kind of phrase. I told you last time that the first week of September is observed as the National Nutrition Week, and so I thought I'll just continue with the SIP on speaking about nutrition and health and how you can stay in the pink of health. One of the biggest problems that we have as far as nutrition is concerned, and biggest nutrition problem that we have, is anemia. You've probably heard the word often, but you need to know what exactly that is. And I thought I'll just explain that a bit in today's tip. We need to keep our hemoglobin level at the optimal level. And so, what is that optimal level that it should be? Because hemoglobin is important to carry oxygen all around. If you have less hemoglobin, oxygen will not go to the whole part of your body, as a result of which there'll be a lot of problems and a lot of symptoms that will be seen. For example, you could be having fatigue, you'll feel tired, you can get headaches, you can have pallor. Pallor is like when you're pale, the skin will be whitish, will be pale. You can have pallor in the eyes. If you look at the eyes there, you'll be able to see the sclera is very pale, or your nails will be, you have nice and pink nails now. It will be pale if you're having low amount of hemoglobin. So that's how the phrase comes, pink of health. If you're nice and pink, it means your hemoglobin level is high, as a result of which everything is functioning well. It's a kind of an indicator that you're eating well. So it's kind of, if your hemoglobin is low, it means that something has gone wrong in your diet. You could also have pain in the joints, and you could have cold hands. So all these are symptoms of anemia. Now, what should be the level of hemoglobin? In men, the hemoglobin level should be between 14 to 18. 14 to 18. In women, it should be between 12 to 16. So this is the normal hemoglobin level when you're not anemic. If it is less, then you'll say that the person is anemic. In men, it is 14 to 18. In women, it is 12 to 16. If it is less, then we'll say the person is anemic. Now, if it comes up to 10, you will say the person is having mild anemia. If the hemoglobin level comes up to as low as 10, you'll say the person has mild anemia. You have to do something about it. You have to start improving the diet, find out what the cause is, and try to address that. Mild anemia. If it is between 8 to 10, you'll say the person has moderate anemia. And if it is between 6.5 to 7 or to 8, then you'll say the person is having severe anemia. If it is less than 6.5, the person is having life-threatening anemia. So it could be very bad for that person, and there must be some cause why it is 6.5 and or below. So you have to investigate the cause. There are various causes. Let me not get into that. Could be a bleed, for example, or mainly it could be iron deficiency which causes the anemia. The government has launched what is called the Anemia Mukta Bharat, trying to address anemia, especially in the vulnerable groups. So pregnancy, lactation, these are the vulnerable groups. The elderly population are also vulnerable, as a result of which you need to make sure that all of you have done your hemoglobin levels and watch out for these symptoms. Especially if you have chronic illness, you need to make sure that you check your hemoglobin levels, because it can come down anytime. A few things you need to know, what increases the hemoglobin level, because main cause I said is iron deficiency anemia. So you get your iron from your diet. Meats will give you iron, egg yolk will give you iron. For those of you who are vegetarians, green leafy vegetables will give you iron. The darker the greens, the more iron it contains. The darker the greens, more iron it will contain. Beans will give you iron, whole grains will give you iron. So there are many sources. Milk will give you iron. So there are many sources of iron that you could have. Also keep in mind, if you have not dewormed yourself for long, some of the hookworms can cause iron deficiency. They can cause bleeds, as a result of which you may have iron deficiency or anemia because of that. You need to make sure that you deworm yourself on the regular basis to overcome that. Remember, there are some food items that can compete with the absorption of iron. For example, if you have tea with your food, it is not a good habit, because tea or tannins compete with the absorption of iron or inhibit the absorption of iron. So don't have tea and coffee with your food, because it kind of affects the absorption of iron. Similarly, calcium. If you take a calcium tablet, when you're taking your iron and folic acid tablet, it will inhibit the absorption of iron. So try to avoid taking the calcium tablet and the iron and folic acid tablet together. Certain things improve the absorption of iron. For example, vitamin C is very good. So if you take vitamin C along with your iron supplements, it'll help in the absorption of iron. So my tip for the day, stay fit, get your hemoglobin checked. If it is low, it can be remedied. So make sure that your hemoglobin is in the optimal level and stay in the pink of health. All the very best.
Thanks, doctor. You've
Most welcome.
kept our hearts sticking and our blood flowing. And I'm sure now we understand why we refer to the pink of health. So the expression, the pink of health. So when you see someone with those lovely pink cheeks, remember that's a sign
You know where
of
the
good
color is
health.
coming from.
Normally we would say somebody's pressure is high because they get all red in the face. So
That can also happen, by the way.
that's so we have to look
Doctor,
out.
Doctor,
Yes.
I just want to ask you one thing.
Yes.
How long, how many times should we take the deworm tablet? After
So it
3 months?
depends on what kind of a risk it is. So for children, we give them a little more often because they cannot touch things and they're more likely to come in contact with worms and get worm infestation. In older people, once in 6 months should be good enough. And it's a very simple tablet, 400 milligrams of albendazole, one at night time, and should do.
I do take it, but I didn't know after how long.
Yeah, once in 6 months is good enough. Yeah.
And also they say if you have pets, no, doctor? Pets.
Yeah,
So when you deworm your pet, deworm
Ah.
yourself.
Yeah.
Yeah.
So if it's higher risk, then we try to give you more often. Yeah.
So that's taking care of our gut. That's gut health also.
Thank you.
Yeah.
So thank you so much, doctor.
Thank you, doctor.